Staten Island is truly a microcosm of the melting pot that is New York. With nearly 500,000 residents, every aspect of the greater New York City metropolis is represented here. In order to create trusting relationships with the many unique segments of our borough, the Staten Island Performing Provider System has made community partnerships a priority. This is Dr. Ginny Mantello, Director of Health and Wellness at the Borough President's Office, and over the next few minutes you will hear from a group of our partners and see how DISRIP is building stronger foundations and enhancing access for our most vulnerable populations. The PPS is establishing trust with the nearly 100,000 immigrants living across the island through partnerships with community organizations.
Staten Island has the largest Liberian population outside of Liberia. So through the SIPPS, we've been able to host multiple classes at Canvas Institute.
Project Hospitality is a partner with great capability and an unparalleled history of service to residents with the direst social, medical, and behavioral health needs. A component of the Emergency Department diversion strategy is the expansion of well-trained mobile outreach teams responding to calls in the field and the provision of detox services in medically managed units. Our behavioral health infrastructure project, the vehicle for our Domain 4 project, is spearheaded by the Staten Island Partnership for Community Wellness and its Executive Director, Adrian Abadi. In 2016, Staten Island had the highest per capita death rate from heroin overdose in New York. Recognizing the need to bring innovative strategies to our borough, the PPS recently embarked on a unique program to staff both of our local emergency departments with 24/7 peer recovery counselors.
We're very lucky to have a peer counselors available 24/7. We're a 70,000 volume ER, so we're very, very busy. We're in an inner city environment. Luckily through the support of the PPS, we were able to get the resources that we needed to treat the special population that we have. To have these funds available and have an organization like the PPS to really just intervene and take project management and make this happen within weeks is pivotal.
Chazzy recently opened a first-of-its-kind 24/7 Resource and Recovery Center supported by OASAS, OMH, and the PPS.
The Next Step Resource Center is a 24-hour resource center for dealing with the crisis of substance use disorder on Staten Island. The District Attorney's HOPE project is working with people who have low-level drug possession offenses to try to steer them out of the criminal justice system and into the health and human services system. And so one of the things that we serve as is we're sort of the receiving partner for that. The reason we call this the Next Step Resource Center is it really is the next step for both individuals and families.
Access is truly a function of trust, not bricks and mortar.
The Staten Island Mental Health Society has been here since 1895. That's over 121 years. We've always been about children and families from the day that we started. The projects that we've been involved with have to do primarily with behavioral health care, but the integration of behavioral health care with primary care services, being able to look at the residents on Staten Island holistically.
Metro Community Health Centers, a network of federally qualified health centers founded by Cerebral Palsy of New York, has been an important patient-centered medical home partner, serving patients with intellectual and developmental disabilities on Staten Island. Cerebral Palsy of New York State has also promoted innovation, using telemedicine to reduce unnecessary emergency department visits. Preparing the new workforce through partnerships with the College of Staten Island and engaging providers in our network has allowed training partners to drive home a message of collaboration. Staten Island is one of the only cities nationwide to require LGBTQ training for its healthcare employees. Through the PPS medical interpreter training, we are complying with class standards.
Innovation, collaboration, and transformation. Those are the hallmarks of the Staten Island PPS. So on behalf of our 75 partners bringing change to our residents, I hope this video captured some of the spirit and determination that we bring to the mission of Medicaid redesign known as DISRIP.